Bismillahirrahmanirrahim. A quote of the day: heat the food to the right degree to make it healthy and germ-free. My topic of presentation is hazard analysis and critical control points. I am Dr. Mehreen Nasir and I am presenting this under supervision of Professor Saira Afzal. Learning outline. I'm going to introduce you to hazard analysis and critical control points. I'm going to discuss the importance. We are going to discuss the 7 principles of hazard analysis and critical control points, the application and situation of Pakistan in food safety. Learning outcome. At the end of the presentation, participants will be able to describe different aspects and 7 principles of hazard analysis and critical control points. A brief introduction about food safety. Food safety is a scientific method describing handling, preparation, and storage of foods in a way that prevents the foodborne illness. Now, for contamination, chemical contamination, and biological contamination. World Food Safety Day is celebrated in June every year. In 2021, it was on 7th June, and the theme this year was Safe Food Now for a Healthy Tomorrow. Now, food safety is everyone's business. Now, why there is a need for an effective food safety assurance method? We all know that foodborne diseases remain one of the most widespread public health outcomes. There are many foodborne outbreaks and there are many issues with food safety. The World Declaration on Nutrition emphasized that hundreds and millions of people suffer from communicable and non-communicable diseases which are caused by contaminated food and water. And moreover, there is increase in number of vulnerable populations such as elderly, immunocompromised, undernourished, and individuals with underlying health problems. So food safety is of prime importance. Now there are broadly 2 ways or 2 categories to ensure the food safety. Number 1 is the microbiological testing, or which is also endpoint testing. Endpoint testing can also be chemical or physical testing. Now, in endpoint testing, the prepared food or the endpoint food is tested for a physical, chemical, and microbiological examination. Now these tests are time consuming and it is done at the end, so there is time wasted. These are expensive tests, and if there is any deviation, no corrective action can be taken. And if the food crosses the critical limits, then we have to waste the food and there is no other option left. The second method to ensure food safety is to establish a preventive and a systematic approach. Now, this will help to minimize the risk of hazards and corrective actions can be taken. So it's a systematic approach in which critical points are set, and if there is any deviation, corrective action can be taken there and then instead of, so this helps us to wastage of food which would have occurred if there is endpoint testing only. Now, a systematic approach, one of the most commonly used systematic approach is hazard analysis and critical control points. As the name indicates, the first part is hazard analysis. We identify all the hazards in the process, and critical control points we set critical control point limits for the hazards. So it evaluates, identifies, and controls hazards. Origin of hazard analysis and critical control point. In 1960, There was a collaborated effort between Pillsbury Company, NASA, and USA Army laboratories with the objective to provide safe food for people going to space. So the astronauts, the people which are going to space, should have safe food, because if the food becomes stale or is not properly safe, so those people don't have any other option of consuming food. They only have the limited supply of food which they take along with them, so that should be very safe. To ensure that the food sent to space was safe, they imposed strict microbial requirements, including pathogen limits. And when the traditional method was used for space food, it was soon realized that almost all the food manufactured was used for testing, and very little was actually left for the actual use. So this was the origin of hazard analysis and critical control pathway by NASA, and Pillsbury first developed the HACCP. In 1971, it was presented in first National Food Safety Conference. In 1980, the WHO and National Aeronautics and Space Administration published report on HACCP. In 1983, WHO Europe recommended that HACCP should be followed. In 1985, National Academy of Sciences recommended hazard analysis and critical control points. So at the end of 1994, there was formulation of International Hazard Analysis and Critical Control Points Alliance. Now, this was a brief history of or origin of hazard analysis and critical control point. Now, the definition of hazard analysis and critical control point is that it is a scientific, rational, and systematic approach to identify, assess, and control hazards during production, processing, manufacturing, preparation, and use of food to ensure that the food is safe when consumed. There is a term used as safe food from farm to fork. So, which means that from the start of production to the bite, the food should be safe. Now, food safety control in the hazard analysis and critical control point is integrated into a design of process rather than present as ineffective system of endpoint testing. Now, international status currently of hazard analysis and critical control points. WHO has recognized the importance of hazard analysis and critical control point for prevention of foodborne diseases for over 20 years. Codex Alimentarius has also endorsed the hazard analysis and critical control point system as the most cost-effective approach devised to date for ensuring the safety of the food. Coming to the principles of hazard analysis and critical control point. Principle 1 is to conduct a hazard analysis. Number 2, determine the critical control points. Number 3, establish critical limits. 4 is establish a system to monitor control of critical control points. Number 5 is to establish the corrective action to be taken when monitoring indicates that the particular critical control point is not under control. Number 6 is establish procedures for verification to confirm that the hazard analysis and critical control points is working efficiently. And number 7 is to establish documentation concerning all procedures and records appropriate to these principles and their application. We are going to discuss these principles in detail. Number 1 was to conduct hazard analysis. In this principle, we list all the likely occurrences of hazards and their severity and their adverse health effects. Now, evaluation of all hazards quantity and quality wise is done. Now, food hazards can be biological, These can be microorganisms, rodents, pests, or any other biological things. The food hazards can also be chemical, which commonly include pesticides or any other products which damage the food. And physical contaminants can be any broken glass, piece of hair, or any dead organism. Now, we are going to discuss the principles with an example of pasteurization of milk. For pasteurization of milk, when we apply the first principle, which is conduct the hazard analysis, now in conducting the hazard analysis, all the potential steps are written. Now, physical hazards in pasteurization of milk can be, there can be some dirt entry, or they can be hair particle or any other particle which can be physical hazard. So we list the hazards and also recommend the way that they can be stopped. So physical hazards can be suggested that we can apply a sieve filter of less than 5 nanometer. So that will prevent the dirt size particles, the hair from entering the milk. Then there can be chemical hazards, which can be hormones, pesticides, or any other chemicals. The third can be biological hazards, which can be microorganisms or any other organism. So the first step is to conduct a hazard analysis. In hazard analysis, we list all the common or likely hazards, and we also recommend the way that we can stop them or reduce them or prevent them. After we have done the hazard analysis, the principle 2 is identify critical control points. It is a step at which control has to be applied to prevent, eliminate, or reduce health hazards. So, in identifying the hazards, we suggested that ways that we can prevent biological growth by certain temperature, for example, 70 degree for 15 seconds in pasteurization, and filter of less than 9 nanometer can be sieve can be applied for reducing the physical hazard. So in identifying critical control points, a decision tree is made. Now, after identifying the hazards, is it biological, chemical, or environmental hazard of sufficient likelihood of and severity to warrant its control? If it is yes, then we apply the, for example, if the hazard is hair particles. So are there preventive measures in place? Yes, we can apply filter. Yes. So that does that measure reduce the hazard? Yes. So that is a critical control point. And when, for example, if we take another example of chemical hormones, so is there a preventive measure in place? After we have the milk, there is no preventive measure in place. So if we have to control it, we have to improve the feed or stop giving hormones to the cows. So critical control points are those points which can limit, reduce, or prevent the hazard from occurring. After establishing the critical control point, we establish critical limits. It is the maximum or minimum value to which hazard must be controlled at critical control point. This is the point which distinguishes between acceptable and unacceptable level. For example, we don't want any salmonella growth in the milk. So the acceptable critical limit is salmonella should be 0. Even if salmonella is 1 per gram, so it is crossing the critical limits, and something should be done about it. In pesticide residual effect, for example, we cannot make it zero. So there should be a limit, like pesticide residual effect should be less than 0.5 microgram per ml. So as a critical limit, we define that what is acceptable to us and what is unacceptable to us. After that, monitoring of the step is done. Monitoring at each critical point to check whether the step is within limits established by principle 3. So the principle 3 was to establish critical limits. So after we get the milk, we identify if the salmonella is 0, which was our critical limit, or if the pesticide residual effect is less than 0.5, which was our critical limit. So we monitor. So we establish a system for monitoring. Number 5th principle is establishing corrective actions after monitoring is done. So we came to know that one of the our recommendation was not following the critical limit. So corrective actions has to be established if the values start to deviate from critical control point, so that process takes place according to plan. And what should be done if critical limits are crossed? For example, there is a hair particle or something, we can do something about it as given in the hazard analysis and critical control program. So we can do it again. After monitoring, corrective actions can be taken. Or for example, the pesticide residual is more than 0.5, which was our critical limit. So nothing can be done. So we have to discard the milk. So corrective actions can be taken for some of the hazards, but cannot be taken for all the hazards. And as mentioned in the critical limits, if the milk is not up to the mark, we have to discard it. Now, principle number 6 is verification. All the steps are verified by some kind of authority, so the execution of the plan is according to rules, or to confirm the effectiveness of the process of hazard analysis and critical control point. The last principle is record keeping. Documentation for inspection, audits, review of critical limit deviation, and routine checks. Now, how should be hazard analysis and critical control points applied? Now, for the application, we have to assemble a hazard analysis and critical control team, which in case of milk will also introduce, there should be a microbiologist, and we describe the product. We give the second step is physical and chemical characteristics of the milk, that the pH should be 7, or the chemical characteristics should be this. And we identify the intended use. For example, the milk used for consumption, the intended use is consumption. So the critical limits are very strict. And another example is providing raw material of food. For example, the rice, brown rice, unboiled or the raw boiled rice. So the critical limits, they can be microorganism growth. The critical limits are more relaxed, and they are more strict in final product usage. Then we construct a process flow diagram. Process flow diagram means that, for example, in pasteurization factory, the milk enters the factory with trucks, and where it is stored, then how is it pasteurized, then the chamber for rapid cooling, then the packing, and the ultimately from factory to the market. The process flow, after constructing a process flow diagram, we give a logical sequence of hazard analysis or critical control points in process flow diagram. It's at each step or each chamber, we identify which hazards can be take place and what can be the corrective action. And we identify all hazards and identify critical points and limit them with appropriate corrective action, and verification and documentation is done. So it is a brief summary of hazard analysis and critical control points. It is a preventive rather than inspection. It is a systematic approach. It identifies hazards in the process. It identifies critical control points for control and monitoring. And the focus is on safety, not quantity. So it focuses where raw material is coming, what hazards can take place during processing, and filling, and transportation and storage. So it identifies critical points at all steps and identify hazards, set critical limits, and corrective actions are taken at each step, and monitoring is done. Now in Pakistan, food safety standards are checked by the provincial government, but imported foods are regulated by the federal government. Food standards cover agriculture and foodstuff. However, implementation of food safety is still poor in Pakistan. In Punjab, we have Punjab Food Authority. It is running to facilitate the citizens of Punjab with hygiene food products and to aware the people about food safety and its importance. Now, regulations of imported food is with federal government. It applies codex standards of guidelines, and its regulation of imported food. A list of permissible food colors is updated, and for animal products, halal certification is required. And Pakistan is also a member of ISO. Punjab Food Authority has also been established under the Punjab Food Authority Act 2011 to ensure availability and safe and wholesome food for human consumption. Now, Punjab Food Authority, they are doing on-spot testing through kits, which is the endpoint testing to check the quality of food items through the on-spot kits. Kits are used to detect various adulterants in milk, spices, tomato ketchup, and also rancidity in cooking oil and ghee. There are raids at entry points of Lahore. During the milk raids, rapid tests were used to check the possible adulteration of milk with water, urea, formalin, detergents, and starch. Those samples who fail to pass rapid antigen tests are sent to lab for confirmation of the diagnosis. Now there is a issue of substandard oil and ghee. Open oil or ghee cannot be traced back to the manufacturer, due to exposure of air, the shelf life shrinks. Moreover, there exists a strong possibility of uses of substandard or rancid oil by criminal elements. The sale of loose oil is prohibited under the Punjab Pure Food Rules 2011. And tomato ketchup, spices, and rotten egg. Detection of adulteration of starch in tomato ketchup, and it was found out that out of 1032 samples, 140 were found to be adulterated with starch. Now, what are the responsibilities of Punjab Food Authority? They monitor the activities of different industries dealing with the food product manufacturing and to ensure a supply of safe food for the consumers. And number two is they maintain standards and create new rules and standards for different types of food products and also for food additives and packaging. They have to maintain standard of their testing laboratories. They play a role in organizing training sessions for citizens and stakeholders, and they also trace the production lines of different food types and hygiene measures of the industry. Now, how is Punjab Food Authority enforcing the rules? They can send a notice to the stakeholders, they can fine the industry, they can seize a specific product or the whole industry. Now it's time for the updates. There is a symbol which is International Standard Organization 20,000. It is an international standard which specify the requirement of food safety management system that involves the following system, and hazard analysis and critical control point is the fourth element of this. We have all heard that in food product they have written that ISO certified. So ISO certified means that they have a proper food safety management system, which include four elements: interactive communication, system management, prerequisite programs, and hazard analysis and critical control principles are a part of ISO certification of food. Now, this article is highlighting the need of safety assessment. Now, foodborne illnesses are caused by poor hygiene within medical facilities such as cafeteria. And cafeteria, Salmonella, Staphylococcus E. coli, and foodborne microbes were identified in this study, and food safety systems such as HACCP can reduce the ensure food safety and reduce the hazards. Now, implementing framework ISO 2000 and food safety management system in higher educational institute cafes of Pakistan. In this study, that they found that no cafe has been found to follow ISI 22000, and none of these cafes has hazard analysis and critical control point system and documentation related to any point. Addressing the food safety gaps and challenges in consumer health and agriculture export in Pakistan, as there are flaws in the food safety. So these flaws are undermining the international trade and affecting the health of the domestic as well as global consumers. In this study, they have implemented a model for prevention and control of mycotoxins during the production of dried chili pepper. Now, in this study, the hazard analysis and critical control point was implemented to for the production to ensure the food safety and characteristics of products and to expand the market. The most important critical control points were identified in the study. Now, there are many hazard analysis and critical control point certification in Pakistan registered by different agencies and food and safety management in Pakistan documentation is done. Now it's time for the MCQs. A food processing company is being educated about systematic approach of food safety. What does critical control point mean? The point where when food handlers must start to make administrative records in HACCP system, the point when steam starts to rise from food being cooked, number C, when bacteria starts to grow uncomfortably on food, number D, it is the point at which control can be applied to eliminate a food safety hazard or reduce it to acceptable level. Anyone from the class? Yes, the correct answer is D. Because critical control point, after identifying the hazard and at critical control point, the control can be applied which will reduce or eliminate the hazard. A restaurant owner has been advised by the consumers to implement hazard analysis and critical control point. What hazards does HACCP address?
A.
Yes, the correct answer is A. It is used to guide business through the process of identifying food safety hazards. Rest of the option C was closed, that it shows food handlers which utensils to use when cooking meals. this is not the function of hazard analysis and critical control point. This is ISO certification standards, in which there are standards that in which utensils or which temperature the food should be cooked. A restaurant owner is very well aware about the food safety mechanism. He started hazard analysis and critical control point ensuring that they are providing safe food. Which of the following would be critical limit? Washing vegetables before using them, cooking chicken to reach the temperature of 165 degree Fahrenheit for 15 seconds, checking the use of date on the canned ingredients. The temperature food can be kept in fridge. The correct answer is B, because after identifying the critical control point, which is any biological, chemical, or any physical hazard, and suggesting the appropriate use, we suggest, for example, this is a point for microbiological examination in which temperature is should be reached to 165 degree for 15 seconds. A food factory wants to start a food safety system to have international recognition in the market. What is the first stage of starting HACCP system? Putting together a HACCP team, make sure that everyone has correct forms, determine the product lines and distribution channels should be included, creating a flow diagram that gives a clear picture of steps and food processes in the company. The first step of hazard analysis and critical control point was to, for application, the first step was to make a hazard analysis and critical control point team. So A is the correct answer. A food factory is interested in implementing hazard analysis and critical control point in their factory. What are the benefits of implementing hazard analysis and critical control point? It assists food business of preparation. Yes, the correct answer is alpha. It is assisting food business of preparation and supply to identify and manage key controls over processes, therefore ensuring safe food. Factories are advised to keep record of hazard analysis and critical control point system. The record keeping requirements of this plan enables to food handlers to work harder, faster.
C.
Yes, the correct answer is C. It is used for investigators to audit a company and see how well they are complying with the food safety laws over a set period. A potato chips making factory came to know that potatoes they are using have microorganism growth and which is crossing the acceptable level. Corrective actions are put into practice after.
D.
Yes, the
D.
correct answer is B, after monitoring the process. So the first principle was to uh, identify hazard, then identify critical points, then setting critical limits, monitoring, and after that, the fifth principle is corrective actions are taken place. A 20-year-old man is allergic to peanuts. He accidentally consumed peanut butter and was admitted to hospital with severe allergic reaction. The known food allergens are considered to be hazard when undeclared on food product label, sold in interstate commerce, product is made under cottage food law, consumed by highly susceptible population. The correct answer is A, because peanut is not allergen, but when it is undeclared on the label or it is not labeled on the item, so it becomes a food hazard. A food employer sees that the food product being cooked has not reached the proper temperature within the proper time. The next step is to the correct answer is to implement the corrective actions specified in the hazard analysis and critical control program. So after identify monitoring, so this is a step for monitoring, then correct, if it is not proper, then corrective action is taken. A manager wants to know acceptable level of pathogen in food salad per gram. A criteria which separates acceptability from unacceptability is the correct answer is critical limit. After critical control point, there is a critical limit. For example, the pathogens should be less than that, so that's a critical limit. These are the references of my presentation, and thank you.
Okay, thank you very much, Dr. Mehreen. A very nice presentation. It is a little bit difficult topic, and I hope that everybody would make a self-study program in order to have a good grasp on the concepts that have been presented today. As far as this hazard analysis and critical control points are concerned, it is a wonderful presentation. And the most important part is about the research and the recent advances in the development in this field. It is not a new topic, but it is a ever-growing topic. And the food safety control is integrated in hazard analysis and critical control points. And there is always more work that has to be done for the need of an effective food safety programs. This is how beautifully you have described the microbiological and to establish a preventive and systematic approach. I am really encouraged to see that students are working very hard. However, when ever we talk about the critical appraisal of any presentation, I must say that a few more points are required while you are talking about the rapid test for adulteration of food, because they are the screening test. So the screening test, we want to know that how the rapid tests they are being performed in milk, in ghee, in tomato ketchup, etc. And what are the hazards that are being done if these rapid tests, their screening proved to be faulty. If there are false negative results, then what would be the